Joining me now, someone with a medical license, NBC senior medical correspondent who can answer all of our questions, Dr. John Torres. Thanks so much, Dr. Torres. First of all, faces are facing a real challenge. Who to put in first in line after this first phase of frontline health workers? Who goes next? Other frontline workers, the meat packers, the teachers, the firefighters, the seniors? You know, these are ethical questions, but they're also very practical questions.
You're right. These are ethical and these are practical questions because people's lives actually are going to depend on them getting the vaccine. And this is one thing medicine's very good at, is doing a triage of saying, okay, who are the ones that need it the most? Let's get it to them. And then let's eventually start getting it to the more people who might not need it as much, but still are eventually going to need it. And if you look state to state, it can be very dependent. The CDC came out with their recommendations on how you should phase in individuals. And that was usually frontline healthcare workers and then those in long-term care facilities. Other states are saying, okay, we understand that, frontline healthcare workers, but we might only have 900 shots and we have 2,000 people that need them. What are we going to do here? And so some states are opting, or some hospitals are saying, let's have a lottery system and do it that way. Here in Colorado, where I live, what they're doing is a system set up where if you work directly with COVID patients, 15 minutes or more a day, so that puts you at a higher risk, then you get in that first phase. If you don't work with COVID patients, but you're still a healthcare worker, you're lower down in that first phase. So you will get yours, but you'll get them eventually. And they're being very creative in how they're doing this, and justifiably so, because there's a limited supply and there's a much bigger demand. And so until they get more vaccines, and the Moderna one looks like it's coming pretty soon, it's going to be a tough battle to figure out who to get it to. And there's going to be some people getting it early, some people getting it a little bit later, but hopefully everybody gets it and they stay safe in the interim.
And there's also a good argument to make for getting it to Black people and Latino people, people of color who are more vulnerable to COVID and are also more likely to be frontline workers.
Exactly. And that's one of the things they're looking at as well, are who are the ones that are most vulnerable? Who are the ones that are higher risk for having complications from getting COVID? And not only higher complications from getting COVID, but also more likely to get COVID because of the environment they're in. And like I said, some states like Colorado is looking at that and saying, let's get those people vaccinated first. Other places are saying, well, let's do a lottery system because we want to be fair across the board. It's going to vary not just state to state, but also county to county, hospital system to hospital system. And you're going to see throughout the country a variety of different systems they're using to get people vaccinated. But eventually, I think over the next few weeks, you're going to see that kind of even out and then decide, okay, well, let's have one system that seems to be working really well and get people the vaccines who need it, at least early on.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.